Good morning, students. This is a second lecture of reproductive health for third year nursing Adal Medical University. Good. Last time we have seen different topics of this, like early pregnancy and what is early pregnancy, what are the cause of early pregnancies. Today we will continue with teenage pregnancy. Good. So, what is teenage pregnancy and what are the cause of teenage pregnancy? So, at the end of this topic, you should answer such question. Good. So, what is teenagers? So, let's start with teenagers. What do you mean teenagers? Teenagers means boys and the girls in their ages between 13 to 19 years that are still not out or in problems. It is a transition period between childhood and adulthood. They are no longer children and yet no yet adults. Teenage or teens pregnancy means simply a pregnancy before 19 years, including 19 years. Let's see some demographics of teenage pregnancy. Worldwide, about 16 million girls aged 15 to 19 years give birth every year. This accounts for about 11% of all births, that is, 1 in 11 babies is born to an adolescent mother. Worldwide, the majority of adolescent mothers are married and most of their babies are wanted. In the developing world, about 90% of births to adolescents, 3 out of 4 pregnancy in this age group occur in marriage and they are planned. However, this means that every year 4 million adolescents become pregnant unintentionally. Although there are adolescent mothers in all societies, there are huge regional differences. About 90%, 95% of adolescent mothers live in developing countries. The highest level of adolescent pregnancy are found in sub-Saharan countries, especially in sub-Saharan Africa, where each year more than 400,000 teens give birth and 47 teen girls give birth each year. 34% of these births were to girls under age 18, 18, and 66% were to girls age 18 to 19 years. For example, if we take Ethiopia, adolescent youth age 10 to 24 years will constitute about 1/3 of the total population. Young people have profound reproductive health needs because of their biological, psychological, and social changes. HIV, like the other, not only HIV, like sexual infection prevalence and unwanted pregnancy among adolescents and youth are high. Most induced and unsafe abortions are among 15 to 25 years of old. What are the factors associated with teenage pregnancy? Like poverty, unemployment, abuse, early menarche, gang activity, domestic violence or coercion, like home or familial cruelty, early marriage, rape, social pressures, low self-esteem, school dropouts, poor educational opportunities, poor access to healthcare, influence of the media, alcoholism, and substance abuse. These are special factors associated with teenage pregnancy. So if there is this factors, teenage pregnancy will increase. What is the complication of early pregnancy or birth or postpartum? There are high risk. So one special complication is like hypertension, the other is eclampsia, the other is anemia, the other is difficult of labor and childbirth as a result of cephalopelvic disproportion, CPD, what we call, because the female is not mature, her pelvic bone is not matured, the head of the child and the pelvic is not proportional. This is what we call it CPD, or cephalopelvic disproportion. The other is low birth weight. Due to this all, the teenage pregnancy's complication is increased, and again it increases maternal and the child mortality. The National Early Pregnancy Prevention Program. What is this program? The program is named as PAIR, which is very successful if it is handled very well. So PAIR means PARE, which means Parent-Adolescent Relationship Education. This program emphasized on importance of parental involvement while include collaborative approaches by teens, their families, teachers, health professionals, business, faith community, lawmakers, and other community organizations on information about reproductive sex risks and safe sex behavior, including contraception and abstinence to reduce early pregnancy. So the program provides a curriculum for prevention of sexually transmitted diseases and pregnancy in middle school use, and focuses on strengthening family communication about sexual issues and the behaviors to help prevent teenage pregnancy, because it is not only the female who can decide on their future careers. It is their families who is going to decide whether they are going to marry it or no. That's why the first program here is including parent. If the parent have aware about this, so that they may decrease, and so that they are going to send their child to the school, so teenage pregnancy may be decreased. The other is unwanted pregnancy. Unwanted pregnancy means simply a pregnancy that a woman or a girl decides of her own free will is undesired. Epidemiologically, nearly 40% of 182 million pregnancies each year in the developing world are unwanted or ill-timed. Total pregnancy, about 450 million of this total. The other 46 million, 25.3% is unwanted pregnancy end in abortion each year. That means about 20 million of which are not safe or unsafe. What are the causes of unwanted pregnancy? There are different causes. From these, like lack of information. Maybe they have no information about limited access to service, financial constraints, personal belief, family objections, and healthy concerns. So these are the major causes of unwanted pregnancy. If you observe the demography here, what will be the fate of unwanted pregnancy? Like about 15% of these are miscarriage or stillbirths, about 22% of these are induced abortion, only about 63% are live births. Therefore, most of the unwanted pregnancy are induced abortion. Induced abortion. That means they will try to do or remove the fetus from their uterus. That's induced abortion. Good. So this is all about unwanted pregnancy and the teenage pregnancy. The other is abortion. Let's see abortion. Even if abortion is not legal, maybe it will be legal with special concerns. In general, abortion is not legal, yes. In most of the countries, it is not legal. But if there is special cases, sometimes there may be a reason for abortion. Because we have say about 22% of unwanted pregnancy end with abortion. So let's see what's abortion and a different classification of abortion and a reason for abortion. So have attention. Good. So abortion means simply the termination of pregnancy before fetal viability, which is conventionally taken to be less than 28 weeks of gestation, or where last menstrual period is not known, a birth weight of less than 1000 gram or less than 1 kilogram is considered as abortion. What will be the reason increasing abortion? In a study by Ronkel in 27 countries, women cited that most of the common reason for having abortion was to postpone or to stop childbearing. Among the reasons for this are the changing trends worldwide, such as the shift from rural to the urban, so that the desire for smaller families. What's the legal status of abortion? Increasing legal access to abortion is associated with improvement in sexual and reproductive health. Conversely, unsafe abortion and related mortality are both highest in countries with narrow grounds for legal abortion. If there is no legal abortion, they are going to try the other things. That is what we call it unsafe abortion. That's why we say in countries where there is no legal grounds, special legal grounds with abortion, unsafe abortion is increased. What are the risk factors related to abortion mortality? Like age is one of the special risk factors, general state of the health, gestational age, method of termination, technical competency, availability and accessibility of facilities. Don't forget, I will ask you this question. What are the risk factors related to abortion? There are major about 7 or 6 risk factors. Good. So, what do you think the causes of maternal death in different countries? For example, mother are going to die related to births. In general, in different country, even if the demography is different, in developing country, mostly it is the same. For example, if we take Ethiopia, observe this demography. Mothers are going to die due to abortion about 32%. Look how much it is very high. Due to hemorrhage after birth, what we call it PPH, postpartum hemorrhage, only 10%. Sepsis, developing infection, about 12%. Hypertension related to pregnancy most of the time, 9%. And obstructive labor is about 22%. From other case, only 15%. Look, from this, cause of the mother death is what? Abortion. So let's see abortion one by one. Good. What are the types of abortion? Like we can classify as spontaneous versus induced abortion, treated or inevitable abortion, incomplete or complete abortion, safe or unsafe abortion, septic abortion, missed abortion, recurrent and habitual abortion. Good. Was it spontaneous abortion? Naturally initiated vaginal bleeding. Spontaneous is by itself, not threatened, that means. By itself, there may be abortion. 15 to 20% of pregnancy end in spontaneous abortion. Subclassification, it can be threatened abortion. It can be inevitable abortion. It can be incomplete abortion. It can be missed abortion, septic abortion, complete abortion, and recurrent spontaneous abortion. These all are spontaneous abortion. Threatened when we say vaginal bleeding with closed cervix before 28 weeks of gestation. About 95% of pregnancy continued before first trimester. The second one is inevitable abortion, vaginal bleeding with dilated cervix, not closed cervix, dilated cervix, but no products of conception have been expelled. Incomplete abortion means some, but not all products of conception have been expelled. Some of them are expelled, not complete. Missed abortion, pregnancy with fetal damage, but no uterine activity to expel the fetus. Septic, when we say spontaneous or induced abortion, complicated by intrauterine infection. Complete means fetus and all products of consumption are expelled without any surgical or medical intervention. Recurrent spontaneous abortion means 3 or more consecutive pregnancy loss. This is what we call it, recurrent. So these are spontaneous abortion. The second one is induced abortion. Induced abortion is different from spontaneous. Spontaneous is by itself, naturally initiated vaginal bleeding. But induced abortion, when we say, it's a deliberate procedure done for terminating an unwanted pregnancy. So it is a planned that one individual is going to stop the fetus. It is not by itself. It is deliberate procedures. What are subclassification of this induced? Maybe it can be safe or unsafe abortion. Safe induced, when we say a procedure for terminating unwanted pregnancy that is done by a person who has necessary skill and conducted in an environment that has a minimal medical standards, like in hospitals, in health centers. Safe-induced abortion largely practiced under police or under the law of legal in many countries. But those did not fulfill the criteria or those unable to get access to the service, they may encounter unsafe-induced abortion. Unsafe-induced abortion means WHO refers to unsafe abortion is a procedure for terminating unwanted pregnancy, one which is done by a person who may lack the necessary skill, who have no necessary skill to do abortion. One. Second, conducted in an environment that lacks a minimal medical standard or both. So this is unsafe induced abortion. Unsafe abortion may be performed by a woman herself or by non-medical person or by health workers in unhygienic conditions. Such abortion may be induced by insertion of a solid object, usually root, twig, or catheter, into the uterus by improperly performed dilatation and curettage procedure, the injection of harmful substance or exertion of external forces. Effect of unsafe abortion on maternal days. What will be the effects? Unsafe abortion is leading cause of maternal mortality. We have said what's the total percent? About 22% is going to be let the mother to die. Of all. Now, 13% of the world, 17% of East Africa, and 32% of Ethiopia, for example, they are lead to death. Observe how much it is very difficult. What is the consequence of unsafe abortion? Let's see simply. Safe abortion performed by qualified person using correct techniques and under sanitary conditions, such as well as spontaneous abortion are rarely fatal and seldom present complications. However, the risk of death following complication of unsafe abortion procedures in developing country is 1 in 250 procedures are against 1 in 3,750 procedures in developed countries. The consequence of unsafe abortion includes place great clinical, material, and financial demands on the scarce hospital resources of many developing countries. There can be life-threatening complications like sepsis may develop, hemorrhages, uterine perforation, and cervical trauma, which can lead to infertility, ectopic pregnancy, permanent physical impairment like PID, tubal occlusion, and chronic morbidity, which in turn may lead to increased risk of spontaneous abortion and premature delivery. This may occur due to hemorrhage, gas gangrene, and renal failure. This is all about abortion. So abortion is very serious, especially of all courses, of all cases regarding the death to the mother. Abortion accounts more, which is about 32% of the total. Good. The other is emergency reproductive health service. What are emergency reproductive health services? There are special too. These are post-abortal care and emergency contraceptive. What is post-abortal care? Is a service delivery strategy built under 5 elements, namely emergency treatment service. One, post-abortal, when we say after abortion, what will be the care? Emergency treatment service for incomplete abortion and the related complication to reduce morbidity and mortality, implying the use of appropriate technology which involved both medical and surgical interventions as necessary. Needless to say, it requires the availability of equipment, supplies, and the medications which are appropriate to the specific service delivery setting. Technical competency is proficiency with which all members of the healthy care team perform the task involved in post-abortion care. The second one is post-abortion family planning. Don't forget the 5 elements. One is emergency treatment service. Second is post-abortal family planning or contraceptive, based on informed choice in the use of method to prevent unwanted pregnancy. You should inform the types of contraceptive, all of them. Then after information, they are going to decide on which types they are going to take. This is all modern contraceptive method can be used immediately after abortion care. Appropriate client screening and informed choice. Women should abstain from sexual intercourse until post-abortal bleeding stop and all complications are resolved. Naturally, family planning is not recommended until a regular menstrual pattern returns. Good. The third one is counseling. Good counseling and educating about sexual transmitted infection, safe abortion, HIV is mandatory prior to the patient's discharge from the healthy facility. So once they come to health service, healthy professional should counsel about everything. It can be about STI, HIV, abortion, everything. The fourth one is comprehensive reproductive health service to improve women's overall healthy status. The fifth one is community service provider partnership. So these are the major 5 elements. Don't forget, I will ask you them. Good. The second one is emergency contraceptive. What is emergency contraceptive? What's contraceptive first? Contraceptive is method women can use to prevent unwanted pregnancy in the first few days following unprotected sex, usually within 72 hours of intercourse. The most common method of emergency contraceptive is to take a specific increased dose of combined oral contraceptive (COC) pills. So emergency contraceptive is especially appropriate for women who have experienced condom failure or sexual coercion or violence. Good. So what are the two types of emergency reproductive health? One is post-abortal care, the other is emergency contraceptive. What are the elements of post-abortal care? There are major 5 elements of post-abortal care. What about emergency contraceptive? Emergency contraceptive means immediately after one female do sexual intercourse within 72 hours, they should take emergency contraceptive. Emergency contraceptive is not routinely taken. Don't forget. Not all the time taken because it has side effects again. Therefore, emergency contraceptive is very special. Don't forget this one. Good. So next week we will see sexually transmitted infection. What is the definition of sexually transmitted infection, including HIV? What is its epidemiology? What is its cause? What is its spread? What's complications? We will see all sexually transmitted infection. See you until that. If you have a question, write me on my WhatsApp. Bye bye.